Welcome back to Ofteners Again. My name is Sandro. This is NCLEX PN Review Lesson 12. We're going to be doing cardiovascular medication questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. The nurse reinforces discharge instructions to a postoperative client who is taking warfarin sodium. Which statement made by the client reflects the need for further teaching? A. I will take my pills every day at the same time. B. I will be certain to avoid alcohol consumption. C. I have already called my family to pick up a medic alert bracelet. D. I will take Ecotrin for my headaches because it is coated. The correct answer is D. I will take Ecotrin for my headaches because it is coated. Rationale: Ecotrin is an aspirin-containing product and should be avoided. Alcohol consumption should be avoided by a client taking warfarin sodium. Taking prescribed medication at the same time each day increases client compliance. The medic alert bracelet provides healthcare personnel emergency information. Question 2. Heparin sodium is prescribed for the client. Which laboratory result indicates that the heparin is prescribed at a therapeutic level? A. Prothrombin time of 21 seconds. B. Thrombocyte count of 100,000 cells/cubic millimeter. C. International normalized ratio of 2.3. D. Activated partial thromboplastin time of 55 seconds. The correct answer is D. Activated partial thromboplastin time of 55 seconds. Rationale: the activated partial thromboplastin time will assess the therapeutic effect of heparin sodium. The prothrombin time and international normalized ratio will assess for the therapeutic effect of warfarin sodium. A decreased thrombocyte count can cause bleeding. Question 3. The nurse is monitoring a client who is taking propranolol. Which data collection finding would indicate a potential serious complication associated with propranolol? A. The development of complaints of insomnia. B. The development of audible expiratory wheezes. C. A baseline blood pressure of 150/80 mm of mercury, followed by a blood pressure of 138/72 mm of mercury, after 2 doses of the medication. D. A baseline resting heart rate of 88 beats per minute, followed by a resting heart rate of 72 beats per minute, after 2 doses of the medication. The correct answer is B. The development of audible expiratory wheezes. Rationale: audible expiratory wheezes may indicate a serious adverse reaction of bronchospasm. Beta blockers may induce this reaction, particularly in clients with chronic obstructive pulmonary disease or asthma. Normal decreases in blood pressure and heart rate are expected. Insomnia is a frequent mild side effect and should be monitored. Question 4. Isosorbide mononitrate is prescribed for a client with angina pectoris. The client tells the nurse that the medication is causing a chronic headache. Which action should the nurse suggest to the client? A. Cut the dose in half. B. Discontinue the medication. C. Take the medication with food. D. Contact the healthcare provider. The correct answer is C. Take the medication with food. Rationale: isosorbide mononitrate is an anti-anginal medication. Headache is a frequent side effect of isosorbide mononitrate and usually disappears during continued therapy. If a headache occurs during therapy, the client should be instructed to take the medication with food or meals. It is not necessary to contact the HCP unless the headaches persist with therapy. It is not appropriate to instruct the client to discontinue therapy or adjust the dosages. Question 5. A client is diagnosed with an acute myocardial infarction and is receiving tissue plasminogen activator, alteplase. Which action is a priority nursing intervention? A. Monitor for renal kidney failure. B. Monitor psychosocial status. C. Monitor for signs of bleeding. D. Have heparin sodium available. The correct answer is C. Monitor for signs of bleeding. Rationale: tissue plasminogen activator is a thrombolytic. Hemorrhage is a complication of any type of thrombolytic medication. The client is monitored for bleeding. Monitoring for renal failure and monitoring the client's psychosocial status are important but are not the most critical interventions. Heparin is given after thrombolytic therapy, but the question is not asking about follow-up medications. Question 6. A client with coronary artery disease complains of substernal chest pain. After checking the client's heart rate and blood pressure, the nurse administers nitroglycerin, 0.4 mg, sublingually. After 5 minutes, the client states, "My chest still hurts." Which appropriate actions should the nurse take? Select all that apply. A. Call a code blue. B. Contact the healthcare provider. C. Contact the client's family. D. Collect more data on the client's pain level. E. Check the client's blood pressure. F. Administer a second nitroglycerin, 0.4 mg, sublingually. The correct answers are B. Contact the healthcare provider. D. Collect more data on the client's pain level. E. Check the client's blood pressure. And F. Administer a second nitroglycerin, 0.4 mg, sublingually. Rationale: the usual guideline for administering nitroglycerin tablets for a hospitalized client with chest pain is to administer 1 tablet every 5 minutes PRN for chest pain, for a total dose of 3 tablets. The nurse should notify the health care provider immediately. In this situation, because the client is still complaining of chest pain, the nurse would administer a second nitroglycerin tablet. The nurse would assess the client's pain level and check the client's blood pressure before administering each nitroglycerin dose. There are no data in the question that indicate the need to call a code blue. In addition, it is not necessary to contact the client's family unless the client has requested this. Question 7. The home healthcare nurse is visiting a client with elevated triglyceride levels and a serum cholesterol level of 398 mg per deciliter. The client is taking cholestyramine. Which statement made by the client indicates the need for further teaching? A. Constipation and bloating might be a problem. B. I'll continue to watch my diet and reduce my fats. C. Walking a mile each day will help the whole process. D. I'll continue my nicotinic acid from the health food store. The correct answer is D. I'll continue my nicotinic acid from the health food store. Rationale: nicotinic acid, even in over-the-counter form, should be avoided because it may lead to liver abnormalities. All lipid-lowering medications also can cause liver abnormalities, so a combination of nicotinic acid and cholestyramine resin is to be avoided. Constipation and bloating are the 2 most common side effects. Walking and the reduction of fats in the diet are therapeutic measures to reduce cholesterol and triglyceride levels. Question 8. A client is on nicotinic acid for hyperlipidemia, and the nurse reinforces instructions to the client about the medication. Which statement by the client indicates an understanding of the instructions? A. It is not necessary to avoid the use of alcohol. B. The medication should be taken with meals to decrease flushing. C. Clay-colored stools are a common side effect and should not be of concern. D. Ibuprofen taken 30 minutes before the nicotinic acid should decrease the flushing. The correct answer is D. Ibuprofen taken 30 minutes before the nicotinic acid should decrease the flushing. Rationale: flushing is a side effect of this medication. Aspirin, or a nonsteroidal anti-inflammatory drug, can be taken 30 minutes before taking the medication to decrease flushing. Alcohol consumption needs to be avoided because it will enhance this side effect. The medication should be taken with meals, this will decrease gastrointestinal upset. Taking the medication with meals has no effect on the flushing. Clay-colored stools are a sign of hepatic dysfunction and should be immediately reported to the health care provider. Question 9. The nurse is planning to administer hydrochlorothiazide to a client. Which are concerns related to the administration of this medication? A. Hyporacemia, hyperkalemia. B. Increased risk of osteoporosis. C. Hypokalemia, hyperglycemia, sulfa allergy. D. Hyperkalemia, hypoglycemia, penicillin allergy. The correct answer is C. Hypokalemia, hyperglycemia, sulfa allergy. Rationale: thiazide diuretics, such as hydrochlorothiazide, are sulfa-based medications, and a client with a sulfa allergy is at risk for an allergic reaction. Also, clients are at risk for hypokalemia, hyperglycemia, hypercalcemia, hyperlipidemia, and hyperuricemia. Question 10. A client with diabetes mellitus, who has been controlled with daily insulin, has been placed on atenolol for the control of angina pectoris. Because of the effects of atenolol, the nurse determines that, which is the most reliable indicator of hypoglycemia? A. Sweating. B. Tachycardia. C. Nervousness. D. Low blood glucose level. The correct answer is D. Low blood glucose level. Rationale: beta-adrenergic blocking agents, such as atenolol, inhibit the appearance of signs and symptoms of acute hypoglycemia, which would include nervousness, increased heart rate, and sweating. Therefore, the client receiving this medication should adhere to the therapeutic regimen and monitor blood glucose levels carefully. Option D is the most reliable indicator of hypoglycemia.
That's all I have for this video. Please like, share. If you have any questions, feel free to let me know in the comment section. If not, I'll see you in the next video. Thanks for watching.